Well, it will become a critically important question in the days ahead. What you should do if you suspect that you or a loved one is infected with the coronavirus. Consultant physician for infectious diseases at Princess Margaret Hospital, Dr. Nakia Forbes, on precautions people should keep in mind.
If you are having flu-like symptoms, they're very common, and we are in flu and cold season. If you are having runny nose, joint pain, cough, and fever, please do not flood the hospitals and community settings, clinics, or doctors' offices, because cold and flu is common. We usually do not go to doctors for that. At this time, there is influenza and colds, but there is also the circulating virus that is easily spread within close contact. If you have flu-like symptoms, stay at home. Do not go to work. Self-isolate yourself. Find a room in your home away from your family that you can rest and take symptomatic relief. Fluids, fever reducers, cough reducers.
For anyone with symptoms, Dr. Forbes suggested calling the doctor's office ahead of time.
We have communicated with the physicians in private practice so that they can be aware of how to sensitize their staff, how to meet patients that are needing care, how to communicate through the surveillance unit to get further guidance. Please, if you are in your doctor's office, doctors, please put a mask on the patient. See them in an isolation room and close the door. Use telemedicine as much as possible. Make yourselves having the opportunity to speak with us through the surveillance unit and through the COVID hotline to get further guidance on how the patient should be managed and or tested. Should that patient need to have supportive care, remember that 80% of persons will have mild infections, mild illness. Those that have moderate problems like shortness of breath or need more respiratory support, we would want to know before the person presents to the health facility so we can put them in the designated isolation unit and that they can be masked with appropriate personal protective equipment and masked so that it can minimize spread in the healthcare setting and for our bigger community.